In this episode of UpTech Report, I interview Bret Larsen, the CEO of eVisit. Historically, the healthcare industry has been slow to catch up to the information technology advancements of the 21st century. eVisit is changing that through their telemedicine platform, currently adopted by over 200 major providers. Bret discusses the challenges of merging healthcare and technology, the elusive goal of product market fit, the obstacles of running a fast scaling company, and what he would have done differently. Thank you so much, Bret, for joining us. I'm excited to learn more about eVisit and also your story and how you are innovating. First off, you're joining us from Phoenix?
Correct, yeah, Phoenix, Arizona.
Awesome. Now, what year did your company start?
I left to start eVisit in November of 2014.
2014. And the industry that you primarily serve is what?
We're in the healthcare space. We're classify ourselves as a virtual care platform. Our target customers are large health systems, anywhere from like mid-market clinics, private clinics, to some of the largest health systems in the country.
And the pain that you are solving for this target market, what is it?
It centers a lot around patient access. I mean, there's a lot of different pain points that I could call out, but at the end of the day, it really comes down to patient access. You know, here in the United States, we don't have for the most part, we don't have a quality of care issue. It's not about whether or not Dr. A, B, or C is providing high quality care. We have probably some of the best healthcare in the world. It typically comes down to access. You know, as a patient, when you can't get in to see your primary care doctor for 20.3 days, which is the national average, that's an access problem. You know, and that results in subpar outcomes for patients if they can even get to their physician in the first place.
So this concept of telemedicine, it was the way to describe this, isn't necessarily new, but what you're looking at is bringing telemedicine to existing providers on a smaller level. Is that correct?
Yeah. So if you look at the models within telemedicine, I think sometimes the term is overly broad, which is why I kind of try to narrow it to virtual care platform. But you have anything from, you know, Teladoc, who has a physician network that they're using to distribute services with their own technology, all the way down to a doctor, an individual who might be taking a phone call within his private practice. And so what eVisit is doing is we don't bring physicians to the table. We're not a direct-to-consumer offering. We go to large health systems and health organizations and give them a platform and a mechanism and the infrastructure to deliver their care remotely with their own physicians to their own patients.
I've tried it out actually personally on the larger scale, not just some telemedicine. I don't even know what it was provided by.
Sure.
And it was fine. It worked. But if I could have connected with my local provider, I think I would have been much more interested in game to repeat it. I've only done it once.
Yeah. I hear that a lot actually. But when it comes from a place of a relationship, you feel a lot more comfortable. There's more consistency. I mean, it's the reason we go to franchised restaurants, right? It's for a consistent experience with a consistent outcome. And we believe at eVisit, when you pair a patient with a provider they know, the outcomes improve.
And that's why you're really helping your customer, which is the provider or institution, patient access. That was the word you said, right? So tell me, how many customers do you guys have or institutions do you have on your platform right now?
Yeah, today we're serving a little over 225 health systems and large clinics in all over the country.
And what does that then turn into patient-wise that they are going through your system?
That's a great question. The best way to answer that is if you measured like size of hospitals in the country by the number of patients they enrolled last year, eVisit would have been the largest hospital in the country if we were a traditional brick and mortar hospital.
Wow, that's impressive. That's impressive. So
really exciting.
Digging into then what that offering looks like when you approach a institution, a local practice, depending on what size you take in, what does those packages or plans look like then that you offer?
Yeah, typically what we bring to the table for large hospital systems, we price them. It's an annual license. It's recurring, subscription based, and it's based off of how many service lines that they're bringing to the table. So today, as a platform, eVisit services over 50 different specialties across our 225 plus customers. So that's everything from something as simple as primary care all the way through to something as complex as oncology. And so based on the use case and the configuration needed on the platform, we'll basically price it out for a specific service line or business unit in that way.
Now, the technology behind it, let's dig into that a bit more. Because I love tech. So what are the different aspects, your own IP that you put into this that is providing value?
That's a great question. So the platform is proprietary from the ground up. Just to kind of walk you from a user flow workflow, as a patient, most patients will never know they're actually using eVisit software. It's white labeled or custom branded as, Florida Hospitals, HelloWell, or eCare, or Ascension's AmitaCare, or, Honor Health's, actually Honor Health calls it eVisit, their Honor Health eVisit. And so we actually come to the table, patient will enroll, they'll go through the intake process, which looks and feels very much like the experience you'd have in clinic. So we collect your demographic information, we collect your insurance information, we ping the clearinghouses to help understand what your copays are and your reimbursement rates are, how much of your deductible you've met. You select your pharmacy, you submit a credit card to pay for the visit, and then you're provided with a list of providers who you can select from. Usually it's your own doctor, but there may be other physicians or physician's assistants or nurse practitioners alongside that who may be more readily available. So if it's something a little more urgent, you can click a visit on demand, or you can schedule a visit out into their calendar. Once you've done that, the provider receives a text message notification that they have a patient in the waiting room. They log in, they can review your chart, your medical history and information. Again, this is usually your doctor, so they have a lot of information on you already, but additional information to supplement that, and they can accept the visit, and you're face-to-face with your physician, and they'll go through the same experience that you'd have in clinic, face-to-face. They'll ask about your symptoms. They'll work to diagnose, and then send a prescription to your pharmacy if needed, that you can pick up in about 10 minutes after the visit's over.
Brilliant. So that whole patient experience, all of walking through that would normally happen in person, can be done online, giving this whole platform for whether it's how small do you go as far as a local clinic or something?
Yeah. We find our sweet spot is typically clinics that have more than 15 clinical providers. We used to, in the very early days, we sold eVisit to single private practice clinicians, and we just found that the platform was a little more robust than what they were able to handle. The support you need internally to get it up and going, we provide an entire team on our end, and we kind of need a team on the other end to help receive that and implement the software.
So a team on both sides to get this running. And the nice thing is you have all of there, but there's still a lot involved. Yeah. As far as then all the different moving pieces, what kind of partnerships have you had to develop? Other, I don't know, APIs or stuff with other types of technology that you've kind of incorporated into your solution?
Yeah, that's a great question. So one example of that is, so we prescribe, or we enable our customers to prescribe to over 70,000 pharmacies nationwide. That's in a partnership with SureScripts. So we leverage the SureScripts network so that we can access e-prescribe into those organizations. We partner with AWS for our cloud infrastructure. They cover our BAA and make sure that they help us stay HIPAA compliant, in addition to all the things that we do internally around that. We've done some pretty unique work in video from like a two-way video perspective that integrates best-in-class video depending on a lot of things that the patient is experiencing. So whether that be low bandwidth, or they're on their cell phone, or they're in a rural setting, we can help identify what video technology is going to be most conducive to that environment, and dynamically pull in that video technology to be able to transact that. So we have multiple different vendors in that regard, and act more as a relay system to kind of swap in and pull out what's going to provide the best experience for the patient.
Gotcha. And then going forward, you have other plans with, obviously, you have all this data, you have all this information for the providers as well as the patients. Do you have ideas or thoughts on how you can, even more technology you could apply, or services you could be adding in?
Yeah, I mean, looking into the future, we're really focused on how do we help for hospitals deliver across the value chain for patients in a care setting. So, what that looks like kind of categorically is how do we help hospital systems attract new patients? If you look at any given hospital, large system in the country, they're acquiring urgent cares. They typically lose money in urgent care, but they're continuing to acquire these locations because it's top of if you think about it from a marketing perspective, it's top of the funnel lead gen to the hospital where they're actually profitable on those procedures. So how do we help hospitals attract new patients while keeping costs low? How do we help them engage those patients in their care? Here in the US, I think probably globally, consumers, we are very reactive to medical needs and care, right? Like I don't go to the doctor until I have a sinus infection or until my appendix is about to explode or whatever the case might be. How do we help consumers become more active in their care and switch hospitals from thinking of us as patients to consumers? The third is care delivery, which is what we're doing today. We're helping hospitals accelerate the way that they're delivering care and simplify the way they're delivering care to their end users. The fourth is how to help them monetize care more straightforward and more simply, both for patients, but also for the systems. I mean, the amount of work and rigor that goes into submitting a medical chart is mind blowing. And there are reasons for that, but it's not conducive to a great experience on either side of the equation. And then the fifth and final is re-engagement. So once someone's received care, how do we help them stay engaged with their care providers to produce better outcomes more consistently?
There's really automating and helping through that entire process from the first time a new patient acquisition to all the way throughout. That's a powerful system. I can see the vision. So you started this is 5 years ago, started. What kind of hurdles have you had to overcome in the last few years that someone else can learn from that you've had to go through?
Oh man, all of them. I think I could go through everything I think that every founder learns over and over and over again with every company. I mean, you're worried about cash flow. You're worried about product market fit. You're worried about, everything that comes up, it's a new hurdle. Some of the things that I think if I could go back and coach myself 5 years ago is, I think one of the biggest things is how you work with people. So just different team members have different motivations. Some people are there for the paycheck, and you can incent them with more money or more options or different incentives that actually get them motivated. Other people could care less about that. Some people want to be praised publicly in front of the entire company. Other people want you to pull them aside. And it's getting to know your team and learning kind of how they receive feedback, how they like feedback, and understanding how to do that. The other thing is just how you yourself scale as a founder, as a CEO. Most people, and there's nothing wrong with this. Most people can move, 1 to 2 stages of an organization as it grows. In order to move more than that, it really is a constant reinvention of yourself. And when you're in a high growth scenario, those stages don't come every 5 or 6 years. They come every 5 or 6 months, right? Like you go from product development and not having any revenue to moving into revenue, and you go from $1,000 in monthly recurring revenue to $88,000 in monthly recurring revenue in the space of 13 months. And there's some real growth challenges that come along with that. And the way that you managed and applied things when you had $1,000 in recurring revenue and 6 employees is very different than what the company needs when you have $1 million in recurring revenue and you have 25 employees. And so, that's really, for me, if I could go back, it would be get a business coach way earlier, map out the milestones, make sure, you need to be focusing on the big rocks that get you your closest milestone, but make sure you know what milestones are after that.
You make a great point that as the CEO or founder, if you're planning on scaling, you're going to have to reinvent yourself for each of these new stages. And plan for it. That's a great point, and realizing you need to plan for that. As you said, it's different when you're smaller, have less employees, less revenue than when you're already scaling. You also mentioned product market fit. Did it take a little while to find product market fit, and when did that happen?
That's really interesting. I think at eVisit, what we recognize, we grew really, really fast, very early on. So I would say we found some semblance of product market fit pretty quickly. If you look at traditional startups or companies, they typically spend the first 2 years trying to figure out the right product and the right market and the right customer and everything in between. We got some really early, like really meaningful early traction. And then right around 24 months into our growth trajectory, we started to see some data points and some themes that made us realize that maybe we weren't targeting exactly the right customer. I mentioned in the early days we'd sell to anyone who had a credit card and $99 a month. And as we started to analyze the data, we realized that those customers didn't use the product the same way that our larger customers who were spending $25,000 a month were using it, and they weren't adopting it as quickly, and they were 5 times more likely to not renew their contracts when the contracts came up for renewal. And so it's hard. I think everyone's looking for that magic bullet where like you just find product market fit. But the reality is the market changes so rapidly, things are happening so quickly that you're constantly trying to find product market fit. You're constantly, like if you're growing, you'll constantly be faced with that challenge of, okay, what does product market fit look like tomorrow or the day after? Because it's not going to be the same as it was today, because the market's changing and the product needs to change.
I appreciate that point that you're constantly trying to find product market fit. Have you ever heard the concept of crossing the chasm from early adopter to then early majority? Do you feel that you have crossed said chasm and now have gotten to the early majority?
No, I don't think the market has crossed the chasm yet. Telemedicine has been around for decades, 30 plus years. I mean, talking to one clinician about a medical chart qualifies as telemedicine. I think the recent shift in telemedicine, the recent kind of where we're finding ourselves sit is truly a virtual care platform, an enterprise-wide solution that can sit across every service line of care that allows you to have one digital front door to the entire system as a patient, that allows you as a system to provide the patient one entry point and then to be able to triage that patient to the most appropriate point of care as quickly as they possibly can to provide the best outcomes and service. And with entrants like these large tech-enabled service plays, as patients, we have more options now. And local healthcare infrastructure needs to compete with that. And I think many of the more forward-thinking ones are starting to come around to that thought, and they're the ones that need to adopt to get to that early majority.
Looking forward, then, 5 years from now, where do you see you guys?
5 years from now, we're the market leader in remote care delivery. We already have some massive wins. Earlier this year, we were recognized by Forrester as one of the top 13 solutions in virtual care, alongside some of the largest providers of virtual care in the country, much better funded, a lot more time in market. I say this a lot, but eVisit had the advantage of we're not so early that we're spending massive amounts of capital to educate the market, and we're not so late that we're spending massive amounts of dollars trying to replace an incumbent solution. We have, I think you hear a lot of founders say this, but luck has a lot to do with it. I'd like to say it's because everyone at eVisit is just remarkably brilliant. The reality is we've gotten really lucky, and we do have really smart people, though. Mm-hmm. Go ahead.
And so it's good to recognize that it's the luck, and knowing that that's where you want to go. You're already poised in the right place, the right time, with the right team. What hurdles do you see that you're going to need to overcome, though, in order to truly be the marketplace leader?
It's continuing to innovate. There's a lot of really bright, well-funded companies in the market. The market, from an outsider's perspective, looks really crowded. The reality is, once you get in and you start to look at nuances, there are very few solutions that are providing total solutions across the value chain of healthcare for these large health systems. And that's what really needs to happen. We need to consolidate the patient experience and make it more consistent, because with consistency comes repeatable outcomes. But it's all the same hurdles. We'll continue to have to try to find product market fit, making sure that we are helping our customers succeed by educating them on best practices and implementation, onboarding. It's going through the motions of how do you help a customer learn how to use your product. And I think that's been one of the big learnings for me is, as you're going to market, you're starting to sell to customers. We're selling to multi-billion-dollar organizations with very intelligent executive teams and strategic teams, and I'm the expert. When I step into a room with those individuals, it's intimidating. But I know more about virtual care and the implementation of virtual care than most anyone else in that room. And coming to the table as a trusted partner instead of you tell me what you want to do.
That's a fantastic point to bring, that as you enter and continue to grow, realizing even though you go into a big company, you need to recognize that you are the expert and you can bring that confidence with you. So for you, one of the points you said, you need to innovate, constantly innovate. So how are you innovating? Where do you go for news and thoughts for new ideas? How are you innovating?
I go to my team. And to be honest, I think as a CEO, I think your role is to enable innovation. If the innovation itself always rests on you, then that's a very small sample size, right? And your ability to actually get anywhere is limited dramatically. I think one of the challenges of growing quickly is constantly surrounding yourselves with the right team members. At eVisit, we're fortunate to have a super strong social mission alongside a very strong financial mission, so it attracts amazing talent. We've got an incredible team. But I think the places I go for innovation are team members, specifically the frontline team members who are seeing the challenges that customers face and we're helping those customers solve those challenges. I think a lot of times innovation comes out of iteration. It's not always a huge firework of an idea that this is going to change everything. It's small changes rapidly till you start to see those outcomes.
For you personally, in growing in your own leadership ability and growing the company, are there any books that you're reading right now, audio books, podcasts that you can share?
Yeah, I think my go-to podcast right now is Masters of Scale by Reid Hoffman. I find that a lot of things that most tech companies are doing or most industries are putting into practice are things that are sometimes overlooked in healthcare because of how guarded healthcare is and how, most of the companies when we started out, their go-to-market strategy were trade shows. We took the approach from a demand gen perspective about content generation and thought leadership and creating a demand gen system. When I was told a lot of times, no, that's not how healthcare buys. And we scaled really nicely doing that. A lot of companies are doing that now. So I tend to go, Masters of Scale is great because you're learning from Google's story and LinkedIn's story and Airbnb. You're seeing how those companies scaled. And there's always application back to a different niche or industry about how to apply those tools.
I need to read that book. I've been hearing it several times, and it's a great point to look into other industries and see how you can apply that to your own, because most likely your own industry is not looking at that one as an example.
A lot of times.
Get us set up. Cool. Thank you again for joining. Is there any other thoughts or that you'd like to share with those who are listening, whether they're entrepreneurs or folks who are trying to build their own product or just technology enthusiasts intrigued in how it's being applied in other industries?
No, I think the most important thing is one of the things I've learned over and over is identify your MVP, your minimum viable product early, and just get it out there. It's a lot of us spend so much time, trying to craft the perfect solution when in reality you can validate a lot with just a web page and the right messaging and a few $100s, and saving yourself a lot of pain and ache on the back end of building something that no one actually wants.
Have you seen a company using AI, machine learning, or other technology to transform the way we live, work, and do business? Go to uptechreport.com and let us know.